Right now, the Valley's safety net hospital needs a larger safety net. Why Valleywise Health is asking voters to sign off on $900 million in borrowing. Also on Sunday Square Off, a new Arizona law requires IDs to access pornographic websites. The sponsor says it's all about protecting kids, while a critic warns it's making the world safer for hackers. Why Adelita Grijalva's victory in a special election for Congress is complicating Speaker Mike Johnson's life. After a new legal setback, will Attorney General Chris Mays keep the fake electors case alive? We start with the vote on Proposition 409. You've probably seen the street signs. Valleywise Health plans to borrow $900 million to expand its healthcare services across Maricopa County. Valleywise Health is the so-called safety net hospital, what many of us knew as the old county hospital at 24th Street in Roosevelt. Joining us to explain what Prop 409 would do and what it would cost taxpayers is Dr. Michael White. He is Valleywise Health's Chief Clinical Officer. Welcome to Square Off.
Thank you very much.
So let's go back to the beginning here. Why does the Valley need what we know as a safety net hospital?
You know, Valleywise Health and safety net hospitals exist in communities to make sure everyone has access to health care. That we want to be there for any citizen and any person that needs health care within Maricopa County to make sure they have those access to resources to take care of their health care needs so they can remain productive and valuable members of our community.
And what kind of services might Valley Health provide that other hospitals, hospital networks don't provide or don't provide as much of?
So Valleywise Health is one of the largest providers of behavioral health care services across the entire county. We are responsible for taking care of those with serious mental illness and those that are undergoing court-ordered evaluation and court-ordered treatment for their mental health conditions. So people that may have some sort of need, may not recognize that need, we're able to care for them, get them into the system to be able to make sure that they're able to be adherent with their therapy and get the treatment they need to return to those lives that they need to do. The other thing that we do within Valleywise Health that's unique is the Diane and Bruce Holly Arizona Burn Center. We're the second largest burn center in the United States and take care of all of those, heat-related conditions and heat-related possibilities that we see certainly here within the desert community that we serve.
And where have you seen the needs grow over the last several years?
Certainly have we seen the county continue to grow. We see the population growth in Maricopa County. The need for those behavioral health services continues to rise. We see the number of patients that are seeking behavioral health services has continued to grow, especially post-pandemic. As we all recognize, we've probably not been talking enough about behavioral health conditions and being open to seek treatment for those conditions as well. By allowing us to have Prop 409, we'll be able to expand our facilities to care for those patients.
How has the rise in the homeless population affected or perhaps created more of a need for behavioral health?
Certainly, homelessness and the unhoused population could be there for many reasons. We certainly recognize that behavioral health conditions and mental health conditions may be one of those causes to do that. So, we want to make sure that we can initiate treatment early, get people on therapy that will help them on that journey to maybe able to be successfully housed and not be in that homeless situation.
I think I read some numbers maybe in the publicity pamphlet for Proposition 409 that the growth in your service and the people you serve is far outstripping your projections.
So as we have undergone the transformation of Valleywise Health, transformation of healthcare within the county, we anticipated population growth, but we're seeing numbers today that we were expecting to see in 2029 and 2030, just based on the growth and the needs within the county. So you're right, we've far outstripped what we anticipated.
And you've touched on some of the reasons, so it's not just population that's responsible for that.
Population is part of it, but it is, again, also the recognition and us as a society being more willing to accept and talk about, seeking treatment for these behavioral health needs.
Let's break down the numbers. According to the Prop 409 information pamphlet, Valleywise wants to borrow $898 million, With interest, that would come to about $1.4 billion. The cost to Maricopa County taxpayers with a home assessed at $250,000 would be about $30 a year for 16 years. So what are the major projects that money would pay for?
That money will help us expand ambulatory care services in the central part of the county. One of our large missions with Valleywise Health is to make sure that we're training the next generation of healthcare professionals. We have a large primary care residency program. We'll be able to do one of our primary care residency clinics in the Central Valley to expand the number of physicians that we're training that will hopefully stay within the valley. We'll also be able to expand behavioral health beds on the Roosevelt campus. Our facility there was built in 1976, houses just under 100 patients. We'll be able to double that capacity to be able to meet the needs of our patients.
And the old county hospital is now being demolished.
Correct. As we were blessed, with Prop 480 to be able to build the new acute care tower, we were able to decommission the old building and bring it down, which will help us expand and put behavioral health beds in that area.
And this does have bipartisan support, including by a former sheriff and a current sheriff, and Valleywise Health's hospitals are important.
Yes,
Valleywise prison system.
Absolutely, we are one of the largest areas that serve our correctional health patients as well around that. And we've enjoyed and are, again, excited that we have bipartisan support across that, as well as, from our religious communities as well.
Now, talking to hospitals, just pulling out the lens a little bit, talking to hospitals right now, they are uniformly concerned about the cuts coming from the federal government, Trump administration, cuts to Medicaid. How has that figured into your planning and maybe what you want to do or the needs you'll see for this money? We certainly see as changes are made in Medicaid, as changes are made with reductions in subsidies for health information, for health care across the exchange. We see the number of patients that may need to use these safety net resources continue to increase by allowing us to have these facilities be able to be prepared for some of these changes that we'll see. And how concerned are you about the possibility of the growth in uncompensated care? We need to make sure that we are efficient and the stewards of the resources that we've been given so we're able to care for and meet the needs of our patients. But is that a real possibility? Absolutely. Looking forward, given what's happening in Washington? We certainly will see a rise in uncompensated care, but we want to be there to be able to meet that, and the support that we have from the community allows us to be there. All right, Dr. Michael White, thanks so much for joining us. I want to let folks know early voting starts on October 8th. Very important, this is a mail-in ballot only election. If you want your voice to be heard, get on the early voting list. Michael White, thanks again for joining us. Thank you.